Hi everyone, for my research project I did neuromuscular effects of massage therapy. So massage therapy is a manual form of therapy that utilizes the manipulation of skeletal muscles by applying different pressures to an area. Massage produces a mechanical pressure which stimulates biomechanical signals that allow for many benefits during this healing and recovery processes for skeletal muscles. So there are a couple of different types of massage therapy, but these are the ones that have some specific neuromuscular effects. So the first one is myotherapy, and this focuses on soft tissue or skeletal muscles after an injury and works to rehab them. The next is remedial therapy, and it works to increase mobilization and maintaining range of motion. The next is reflexology, which utilizes the reflex pathway by creating biomechanical pressure that stimulates the healing process. And lastly, sports medicine is a combination of techniques in order to increase performance and rehabilitate injuries in athletes. So massage therapy greatly helps the process of skeletal muscle repair. So muscle healing includes degeneration, which is the initial injury or tearing of a muscle. Next comes inflammation, where inflammatory mediators rush to the area, stimulating platelets and immune cells to also rush to the area and begin the cleanup process. The next is regeneration, which is the repairing of muscle cells. And lastly, there's fibrosis, which is when skeletal muscle tissue is replaced with irregular connective tissue, so the muscle loses some of its function. But when you introduce massage therapy, it mainly impacts inflammation, which then also just causes a cascade of benefits during the healing process. So first, massage therapy stimulates a biomechanical signal which increases blood flow to an area. With more blood flow brings more platelets and immune cells, speeding up the inflammation process. It also spreads the debris in a larger area, so then the platelets and immune cells are able to break down the debris quicker because it's spread out. And then this also increases the circulation, which allows for a more efficient regeneration and decreases the amount of fibrosis in muscles, saving most of the muscle's function. Next, so skeletal muscle repair greatly relies on angiogenesis, which is the process of creating new vascularization in the area. So angiogenesis is reliant on endothelial growth factors that is stimulated by muscle hypoxia, and it is stimulated because more blood needs to be brought to the area and to increase oxygen levels so that the muscle doesn't die. So massage therapy relies on proper or increased vascularization of muscles due to angiogenesis. It's more efficient if you can bring more blood to the area because there's increased vascularization. So there are a couple of biomechanical mechanisms that massage therapy also affects. So it weakens the production of inflammatory cytokines, tumor necrosis factor alpha, so TNF alpha, and this factor is secreted by macrophages when stimulated by inflammation. It's a pro-inflammatory cascade. And then the other factor that is weakened is interleukin 6. And this is again a pro-inflammatory that promotes the differentiation of immune cells. And when these two factors are stimulated, it increases pain and decreases muscle function because it's trying to form like a kind of protective bubble over the injured area. But massage therapy works to reduce these effects and speed up the recovery process, so it decreases pain and increases muscle function. Another biomechanical mechanism that massage therapy affects is it decreases heat shock protein phosphorylation. So now heat shock proteins are stimulated after a stress is felt by the body. So now there's going to be more heat shock proteins available to create a stabilizing force and allow us to make more new tissue more efficiently. So massage therapy is also important in the recovery process. It can be used to help speed it up and yeah. And so then a common practice for recovery is myofascial release. So in myofascial release, the myofascia or the outer layer of skeletal muscle is massaged. This is either manually by a therapist or even a trainer, or you can use different tools. This allows there to be a release of pressure and tension that was within the muscle. They mostly focus on trigger points. You can see here, this is where a lot of the tension and pressure will build up. So they kind of focus on massaging the trigger points. So this release allows there to be an increase in range of motion, but there is a possibility of a decrease in muscle strength and muscle fiber tension length relationship. But these two are reliant on the changes the massage therapy causes to the overall function of the muscle and the state of relaxation the muscle goes through. Going off of that, the release of pressure and tension in the muscle decreases the mechanical nociceptive threshold as it moves the muscle further into the relaxation state. Also, for recovery, myofascial release can be done by yourself, so without the help of a professional. And you can use tools like balls or rollers in order to create an even and consistent pressure along a muscle, relieving pressure and tension as you move over the muscle. And you will normally use your body weight in order to create enough pressure. You can see that in these are 3 examples of how you could do it for yourself. So going off that, so a really common form of self-myofascial release is rolling massage. And so you use a cylinder of dense foam, and you can pick your kind of hardness, whatever one you want. And so you're able to roll out a lot of different parts of your body. Here you see her rolling out her upper back, but you can do it on your legs, really anywhere in your body. And the benefits that come with using a roller are you increase performance, you increase range of motion, and it also helps to stimulate muscle relaxation. Rolling massage also affects the excitability of the corticospinal pathway. This pathway brings efferent or motor information from the cerebral cortex to the spinal cord. And you can see the pathway here on the right, starting the cerebral cortex all the way down. And massage therapy actually inhibits this pathway, and it allows for an increased range of motion and pain pressure threshold, but this also depends on the intensity of the rolling. So massage therapy has a lot of different problems that it can solve and treat. So the first couple are pain, soreness, and soft tissue injuries. This is kind of discussed in prior slides, how it is able to make inflammation more efficient by releasing pressure and tension and working on muscles. One other thing that it helps treat is anxiety and stress. So it reduces these because of an increase in serotonin and dopamine levels, and then a decrease in cortisol levels. Massage therapy is also able to treat a couple different diseases, one being Parkinson's disease, and massage therapy can help to treat motor and non-motor symptoms of Parkinson's disease, such as tremors, stiffness of muscles, overall mobility, coordination, anxiety and depression, overall muscle tightness, not only in the limbs, but also in the head and neck. And you can also, this increases the quality of life for those with Parkinson's disease. And then you also are able to treat chronic diseases. An example is fibromyalgia. And you're able to massage the area, and then you reduce the pain and increase overall quality of life as well. And then another treatment, you can treat lower back pain with massage, and you use the manual somatic stimulation. Here you see the somatic nervous system pathway, and it focuses on applying pressure to skeletal muscles, which are in charge of the voluntary control of the body. And by working on the afferent sensory neurons and the efferent motor neurons, you're able to improve posture and reduce pain. So lastly, the benefits of massage therapy are a reduction in muscle tension because of the mechanical pressure from massage releases tension and pressure. There is improved circulation because the biomechanical pressure causes blood to rush to an area. Next, the lymphatic system is stimulated and drained due to the increase in pressure. There's an increased mobility and flexibility because there is a release of tension and pressure, allowing the muscles to stretch further. And there's improved recovery of soft tissue. And lastly, there is reduced anxiety and depression due to increased levels of dopamine, serotonin, and decreased levels of cortisol. Here are my works cited. Thank you so much for listening.